Good afternoon, everyone, and welcome. I am Mary Falkenstein, the Executive Director here at Bayside Community Network, and I would like to review with you all our action plan for reopening our day program, employment program, and supported employment programs. But before I do so, I would like to take this opportunity to thank each of you for your patience and understanding during this difficult time. We know this has been difficult on all of our individuals and our families, and we look very forward to getting back to normal. Our plan to reopen Bayside Community Network will occur on Monday, July 6th, 2020. This date will allow us the opportunity to finish some much needed building modifications. We're going to be working on educating and updating our staff on some necessary changes to policies and procedures. Most of those changes are occurring around COVID-19. However, there are some other programmatic changes that we want to review and make sure that our staff are fully up to date with everything that is going on and things that they have missed during their alternate employment assignments. We're also going to use this extra time between now and July 6th to continue to monitor the very changing landscape of COVID-19 and also to keep in mind and review the CDC guidelines and changes that occur to those guidelines on a daily basis. As we reopen, we are looking to have a capacity of no more than 50% of our typical daily capacity. This is in alignment with what the expectations are statewide, and we will continue to monitor those numbers as our time goes on. After the first 4 weeks, we will reevaluate and determine if additional numbers of participants can be added. Each consumer will be assigned as either an A-week attendee or a B-week attendee. In general terms, what this is going to mean to each individual is that each consumer will have the opportunity to attend the day program every other week. Each group will alternate with which week they attend. So for example, A-week attendees will attend the weeks of July 6th and July 20th. B-week attendees will attend the weeks of July 13th and July 27th. By doing this, it allows us, again, the opportunity of being able to provide support to all of our individuals in our day program, with also keeping our numbers at 50% or lower. Consumers and families will be notified by the end of this week by their program coordinator if they are an A attendee or a B attendee. Residential consumers that reside with Bayside Community Network and personal supports consumers that we serve with residential types of services will continue to receive day services in their residential homes during the first 4 weeks of reopening. Additional activities and limited out-of-the-home activities will be added for these residential consumers. The residential management team will be in touch with residential family members of the residential consumers to review schedules and discuss visitations and home visits. The team will be in touch with families prior to July 1st to let you know how things will be running for your loved one. Again, our hope is that our residential consumers will only be continuing their day services in the residential homes for the first 4 weeks of our reopening plan. We have made significant changes to our day schedule in order to meet the guidelines of the CDC as well as recommendations from other entities. Therefore, each day consumer will remain in one group, one classroom for the entirety of their day. Consumer groups will be determined based on which vehicle the individual rides. Therefore, individuals are together from the time they are picked up until the time they are dropped off, reducing the risk of exposure from other individuals. Each classroom will have one assigned instructor, Aides will be assigned to one room and moved only as needed. Each classroom will be located in an area where a bathroom is in the near vicinity. Each classroom will have one specific bathroom that is allocated to that classroom that will only be used by that classroom. Classrooms will have no more than 15 individuals per room. This includes staff and consumers. In fact, most of our classrooms are less than 10. However, we have set the limit at 15 individuals per room as indicated by the guidelines that are out. Rooms will be set up with limited tables and chairs to encourage social distancing in rooms. We know that a lot of our individuals will struggle with social distancing. Therefore, by eliminating some of the seating, changing some of the tables around, we've been able to set up areas to help further encourage someone to maintain a social distance. Class schedules will be developed to ensure that each class has a variety of enjoyable and educational activities that each individual can engage in. We understand that we're going to have a variety of folks in each class, a variety of ability levels, and of a variety of needs. Therefore, our day team is working very hard on developing how those class schedules will look, so that we can make sure that we are reaching everyone's interest level, helping everyone to stay engaged and enjoy their day. We will also be utilizing some outdoor space in order to get individuals out of the building while still maintaining distance from other classroom groups. This may be utilizing some of our vast property here on the grounds, setting up some games and things in some of our yard space, some of our parking space. Again, we're going to have tents available, looking to be creative in what space we do have available. At least for the first 4 weeks that we are underway with our reopening plan, out of the building activities will be temporarily suspended. As time progresses and risk factors are reduced, we will look at adding outings that are outdoors or in open venues. Again, during this time, we're really looking at trying to utilize some of our creativity, some of our vast property space here in order to get folks out of the building, but not in the community. This will, again, help to reduce the risk of further exposure, but also help them so that they're not bored, not in one area all day long without any change of scenery. We know that that's going to be a factor, and we look to do our best to make sure that we have some fun and interesting things to help take up that time and help folks with managing being together. Community volunteering will also be temporarily suspended. Again, this is also a factor based on the places where we are volunteering. Many of those locations are not open, or if they are open, they're only allowing essential folks into the buildings to do what work needs to be done. So again, until the risks have diminished, we will continue to suspend our volunteer program. Once we determine to open outside outings, going out into the community, as well as volunteer opportunities, we will send home permission slips and notification to let you all know what we are doing, and then also to get your input as to whether you would like your loved one to participate in these outings or volunteer opportunities. But again, for the first 4 weeks that we are open, these outings and volunteer opportunities will not be occurring, and it will only occur once we have had time to reevaluate things and notify our families. In order to help protect both our staff and our consumers, we have put additional measures in place. One of those measures is to restrict visitors. Non-essential visitors will not be allowed to enter the building during day hours. So this may be anyone from a workman who needs to do something to help fix a portion of our building, to our CCSs who typically come to visit during the day to do monitoring. Again, non-essential visitors will not be allowed to enter the building during day hours. Team meetings will continue to be held virtually or via phone conference. Any type of business meeting that we need to have, and again, in order to conduct regular ongoing business, will be done virtually or via phone conference. We are also asking that staff that are not working in the day program not come to our facility, that they call first or email. Almost all matters that non-duty staff have should be able to be handled over the phone or through email. This is just another measure that we're doing to reduce our numbers, reduce activity into our building, and to reduce any type of potential spread. Our virtual classes will continue to go on daily during our reopening. Many of you have already taken part of our virtual classes. Many of you have enjoyed them. However, we've also received some feedback as to some changes and suggestions from some of our families. So we're taking all of that into consideration and planning to make these classes more enjoyable for everyone. We would like for individuals who are able to participate in the virtual classes on the weeks when they are not in attendance. Members of our administrative team will be in touch to gather your opinions and suggestions to, again, try and make these classes more inviting and more enjoyable for your loved one. For those that aren't able to attend virtually, we will have packets to complete on your off weeks. These packets can be sent home at the end of the week where you are attending. And that way you'll have packet information to do the following week. If you would like to receive more information about our virtual classes or about our packets, please feel free to reach out to your program coordinator. Another change that we have put in place has been a change to our lunch and break schedule. Lunch and breaks will be held in the classroom or, weather permitting, in the outdoor location. The cafeteria will be closed for open seating. The cafeteria will only make food for lunches. Breakfast will no longer be available at this time. Bought lunches will consist of a brown bag lunch. So that would be the equivalent of a sandwich, chips, fruit, dessert, and a drink. All diet restrictions will be observed. Brown bag lunches allow for easy delivery. They allow for one staff person to prepare the meal, which again helps to reduce the amount of individuals that are involved in the process, and it assists with easy cleanup. Consumers not wanting to buy a lunch here can still bring a bag lunch from home and can have that lunch available. If they need assistance with heating or reheating something, we're more than available to help with doing that. In an effort to keep our numbers low, as well as to keep social distancing and to keep our safety, everyone's safety in mind, we have also made some changes to our transportation program. To reduce the number and allow for better social distancing, our vehicles will transport at 50% or less capacity. Therefore, each van will be split between A and B consumers. So consumers will be picked up according to which week group they have been assigned. So half of a van will be assigned as A week, half of the same van will be assigned as B week. You will ride the van according to which week you have been assigned. Prior to loading the vehicle, our drivers will be taking consumer temperatures. The CDC recommends that if temperatures are 100 degrees or greater, that individuals should not engage in activities where they are around others. The same will be the case for here. So if a temperature is 100 degrees or greater, the consumer will not be permitted to load the vehicle or attend the day program for that day. The driver will be required to inform nursing of anyone with a temperature over 100. A member of our nursing staff will follow up with families to discuss next steps. We know that there are other health-related issues. We know that there are other things that may be occurring as to why someone's temperature may be elevated. But again, for the health and safety of everyone, we take this very seriously, and we will have a member of nursing be in touch with you to discuss next. Consumers that are able are to wear a mask when on the vehicles and any other Bayside property. Mask wearing, and this has been a hot subject for a lot of people, a concern for many, as to what exactly does that mean for my loved one? Do they have to wear a mask? They might not tolerate a mask. We are asking that anyone that is able is to wear a mask when they are on the vehicle or any other Bayside grounds. Therefore, if an individual is only able to wear their mask for a portion of their day and then they can't tolerate the rest of the day, that is fine. If somebody can wear their mask all day and be completely fine and comfortable, we are encouraging that at all as much as possible. However, for individuals that can't tolerate it, whether for medical or other reasons, wearing a mask is not a requirement to attend, but again, we encourage it for the safety of everyone. As much as possible on the vehicle, we will encourage as much space as we possibly can between individuals. Only consumers residing in the same home will be permitted to sit together in close proximity. Disinfecting of our vehicles will occur upon arrival at the center and also at the end of the day after the last individual has been dropped off. Even with reduced capacity, potential exposure is greatest when in a confined space. Therefore, our vehicles are going to be a confined space where the potential exposure is greater. The safest form of transportation is for you to transport your loved one. However, we understand that not everyone can do that. Our vehicles will be running and will be available for transportation. Again, we do want everyone to understand that the safest form of transportation is for you to transport your loved one yourself. We have also made some adjustments and some changes to our employment program. Our employment program will begin to start back up for those who haven't been active as of July 6th. For those individuals who have been working and active during this pandemic, job coaching and employment transportation will continue as it's already been. This is a great time for us to do a little shout out for our essential employees who have been working. These are individuals who we help to support, who have maintained or in a couple cases obtained a job during the pandemic, doing jobs such as working in a grocery store, a restaurant, helping with essential jobs in different work environments. We're very proud of you and very pleased that you have been able to show your skill level during this time. Individuals who only work a portion of their day and then typically would return to our day program will, until further notice, be taken home once their workday ends. So if you work, once your workday is over, you will go home instead of coming to the day program. If you have a work day and then the following day you are off and you would like to come to the day program on your day off, you will follow your A-B schedule as to whether you will be an A week or a B week, and you can come in during your days off if it is your week to be in attendance. Employment discovery, assistance with job searches, application completion, and interviews will resume on an individual comfort level. Some of our individuals are ready, willing, and able to go ahead and start working. Others of our individuals are a little more reserved and want to wait and see how things clear up and pan out before they start working towards that next step in obtaining a job. So for those individuals, again, it's going to be on an individual level as to how employment progression occurs. So your job coach or your program coordinator will be in touch with you as to how you would like to proceed. We've also made a few changes in our personal supports program. Personal supports will be offered on an individual comfort level. So some of our individuals may be comfortable going ahead as of July 6th and starting back up with their personal support services. Other individuals may not yet be ready, and that's fine. Personal supports consumers and families will be contacted prior to July 6th by a member of the personal supports team to determine your comfort level for services. If you are receiving personal support hours, your hours may be adjusted or temporarily reduced based on the needs of the agency at the time. Personal support activities, to begin with, will be limited to outdoor venues, and in some rare occasions, we may assist individuals who need assistance with obtaining essential items at stores, banks, pharmacies. But personal supports activities, for the most part, will be limited to options outdoors in open areas. Again, as stated previously, mask use within the agency. Mask wearing will be required by all drivers, direct care staff, and administrators. So everyone here who works at Bayside will be wearing a mask when your loved one is here. Mask wearing by consumers who are able is encouraged. Again, like I said previously, we understand that some of our individuals are unable to wear or tolerate a mask, and that's okay. To save on our limited supplies of masks, we ask that each consumer provide their own reusable or disposable mask. Bayside can assist those without a mask with getting one. So if you don't have a mask available to you, please contact your program coordinator for assistance. We will make sure that each of our vehicles have a few extras just in case. But again, as you all are aware, supplies globally are limited. So we ask that folks try and help us out by using your own mask and then taking it home at the end of the day. Staffing consumers will be required to disinfect their mask at the end of each day. If you may need assistance with how to disinfect, or if you need assistance disinfecting your mask, again, please speak to your program coordinator, and your program coordinator will help with how that might work. Like many of you, I'm sure disinfecting has become a regular household word. Here at Bayside, there's no difference. We've been disinfecting, cleaning, redoing things during this entire time that we've been closed for our day consumers. Once we reopen, our disinfecting will go into high gear. Our vehicles will be disinfected upon arrival at Bayside and after the last consumer exits at the end of each day. Our classrooms and bathrooms will be disinfected during the day at least 3 times, and again at the end of the day after all staff and consumers have left. Hand sanitizing stations, disinfecting supplies will be readily available throughout the building, each classroom, and on each vehicle. We will also be encouraging daily throughout the day, multiple opportunities for individuals to not only sanitize their hands, but also to wash. We've put additional precautions in place as well. All Bayside staff and any visitors that are deemed essential will have their temperature checked daily prior to entering our building. Anyone with a temperature above 100 degrees will not be permitted to work. Bayside staff have additional personal protective equipment supplies available to them if needed. Again, like we've said previously, non-essential visitors will not be allowed in the building during day hours. Team meetings will continue to be held virtually or via phone conference. Any consumer or staff with symptoms that may signify COVID-19 will be evaluated by the nurse, and if deemed appropriate, will be sent home. Anyone, consumer or staff, who has had close contact with a COVID positive person will be asked to quarantine for the recommended 14-day time frame. For the health and safety of everyone, if your loved one is sick or has had a potential exposure, please do not send them to Bayside. We have numerous people of all ages and health conditions here, and we want everyone to remain healthy and happy. So please, if your loved one is ill, we ask that you keep them home. If there's any concern, we ask that you err on the side of caution. If you are confused, concerned, need a little bit of guidance, please feel free to reach out to our nursing department. They are more than happy to assist with answering questions. If there's any guidance they can give, they can also assist. So please make sure that you reach out if you do have any questions. As you all know, things with COVID-19 since March 16th have changed drastically. Throughout all of this, our staff have received a multitude of education on prevention, precautions, what they should do in order to social distance, how they should properly disinfect, how they put on or take off their personal protective equipment. Even though they've had all of these trainings prior to reopening, we plan on going back over all of this information again. Things have changed. We want to make sure that everyone is receiving the same information and doing things the same way. So everyone will receive a refresher course on COVID-19, the preventions, the precautions, and how to utilize all of those skills that they learned previously and make sure that they're up to date. All of our consumers as well, once they return, will receive some education on not only social distancing, but how to properly wash their hands, how to hand sanitize, how to wear a mask, what to do with that mask at the end of the day, how you disinfect it. So again, that education is going to be a huge important piece. It's going to be something that we're going to do prior to reopening, but we'll also be doing it a lot during those first few weeks and then some to come. So if you hear your individual talk about what they learned today and that those same little buzzwords are part of it, yes, we are going to continue to talk about that so that it is in the forefront of everyone's mind. I believe many of you probably have had the same exposure to the media as we have here, and there's a lot of discussion that COVID may do a reoccurrence in the fall, in the winter. So there may be a chance that we will need to close again after we open. We hope not, but there may be that chance. We will continue to monitor and follow the guidance from the CDC, local and state health officials. We suggest that you all do the same. However, we will inform you as much as we know when we know it and try and give you that information as quickly as possible. Additionally, exposure to COVID-19 in small group settings is possible, even with all the precautions that we've set in place, all the training, all the distancing, the limitations of movement throughout the building, the reduction of community outings. Exposure in confined locations like a vehicle is especially risky. So therefore, we encourage each of you as a family to evaluate the health and safety needs of your loved one, to make the determination if returning is in their best interest. That is a family decision. It is up to you to decide what is in the best course for your loved one. We miss them. We want them to come back. Being here at Bayside each day without them, it's just not the same. We miss them so much and can't wait to see them. But we also want them to stay protected, to stay healthy, to stay happy. So, for those of you who do not wish to return on July 6th, we ask that you take part in either our virtual classes or complete the home packets. We also ask that when your program coordinator calls you, that you discuss that with them as well, so that they know as to whether you plan on coming, what your thought patterns are on your loved one's return. If you have any questions, it's a lot of information that we've gone over with this action plan. and it may be a bit confusing. When your program coordinator calls, please ask those questions of them. They're there to help you. There may be questions that you have that they might not know the answers to. If that's the case, they will take those questions and then get back to you. So I close with saying that we miss each of our individuals deeply. We appreciate you as family members so much. We know how difficult these last few months have been on you all, and we're here. We want to help. We look forward to reopening. We just want to be cautious for everyone's sake. So thank you, and I look forward to seeing everyone soon.